Good afternoon. Thank you for joining us. We'll have more on the deadly heli-skiing crash in northern BC. We'll talk about the rise in the industry and ask what are the safety concerns and precautions. And the Metro Vancouver transit strike is shutting down bus and C-bus service again today. What's behind it and how did we get here? Our Justin McElroy will explain in a few moments. Plus, we'll take your calls on the cost of getting treatment for depression. I'm Michelle Eliot. Welcome to BC Today. Thank you for joining us on CBC Radio 1 and live streaming on the CBC News app, cbc.ca/BC, and on the CBC Vancouver YouTube page. An investigation is underway after a helicopter crashed north of Terrace yesterday afternoon. 3 people are dead and 4 others were taken to hospital in critical condition. Northern Escape Heli-skiing confirmed the deaths in a statement last night, saying the company expressed its condolences to those affected by the crash. Now, the cause is still unknown. RCMP say the aircraft was one of 3 helicopters taking people heli-skiing in the area. And they say communication was lost with one of the helicopters and a crash site was located in a snowfield only accessible by helicopter. We're going to hear from an aviation industry expert in a moment. First, Chris Rubens has experience riding helicopters in the area. He's a professional skier and ambassador with Avalanche Canada. He spoke to CBC from Revelstoke in the Kootenays.
The big thing with flying helicopters in the mountains is you're doing it all by line of sight or like visual reference. So if you're out in the ocean or out in the plains, you can use your instruments. But in the mountains, it's all visual reference. So if a pilot loses his visual reference, it's very easy for the airplane to crash. A lot of times, like in the winter, you're flying around fog. It's just like it's part of the game that you're playing out there. So you will be flying close to trees. It can happen in pickups and takeoffs. You'll just like nick a tree. There's definitely risks associated with flying helicopters in mountains. The whole heli-skiing thing it's a challenging thing, you know. It's increased a lot in popularity over the years, and it is very safe, but it's one of those things that you cannot control everything, and there are dangers associated with it. And all these companies are working with the best pilots, best companies, and best guides in the world, and they're continuing to learn every year, and it gets safer every year, but it does have its risks, and it's incredibly sad when something like this happens.
For more on heli-skiing and safety, we reached John Graddick, who's a lecturer and coordinator of the Aviation Management Program at McGill University. Good afternoon. Thanks for joining us.
My pleasure to be here with you.
What's your reaction to this deadly crash?
Oh, it's tragic. You know, I think that, you talk about, the previous comments you had from your professional skier, summarize it very well. When you're doing heli skiing, it is a risk environment. You have to make sure that you understand what those risks are and that you take the appropriate precautions when doing heli skiing. But if you make a decision to go heli skiing, you have to understand that this is not something that is risk-free. Weather, pilot skills, terrain, all of those things can affect the safety and security of your travels into heli-skiing territory.
He also talked about the rise in popularity of heli-skiing. Just how much has this industry grown?
Oh, it's grown by leaps and bounds. I think that, I don't know what the last count was, but there's at least 20 or 30 companies in the Alberta, BC, territories that basically offer heli-skiing packages. Some have been around for 15, 20 years. Some are just getting into the business. And, it's one that has a lot of interest. It is very expensive to basically take a heli-skiing excursion. And that's attracting more and more companies, more and more helicopter operators to get into this business. It may be attracting a little too much attention for new entrants, but I think that I believe that there is a need to have a greater oversight in terms of the skill sets and the general understanding of what it takes to be a heli skiing pilot and flying in those conditions.
And as it stands now, we don't know the cause of the crash, but as it stands now, what kind of oversight is there?
Well, right now, you have to have a license to fly helicopters. The Augusta airplane, the Augusta aircraft that was used in this flight, there is a licensing requirement for the aircraft operator to be allowed to use that aircraft. I'm not sure exactly what the operator, what the company has in terms of additional training and additional requirements for ensuring that their pilots are capable of understanding one, the terrain they're going to be flying in, and two, the operating conditions associated with flying people under less than ideal flying conditions. So there is additional training that is the responsibility of the operator. And that's probably where there might be a need to make sure that we have a consistent set of regulations that covers all the operators associated with heli skiing, something that's not there now.
And at this point, as I mentioned, there is an investigation underway. What would be some of the things that they would look at?
Oh, I think that the TSB is really going to be the organization that's going to be
The
leading the charge
Transportation
on this one.
Safety Board, yeah.
Yeah,
Pardon me.
sorry, the TSB, Transportation Safety Board in Ottawa, has sent investigators or is in the process of shipping investigators over to Terrace to look at the territory to see what data they can gather. They will be looking at all kinds of, things like, pilot training, pilot competencies, pilot skills. They're going to be looking at the aircraft to make sure wasn't any mechanical issues associated with that aircraft. They're looking at the mechanical history of that aircraft. So they're very experienced in looking at accidents. Unfortunately, there's been, I would say, an inordinate number of accidents with heli skiing aircraft and heli skiing excursion takers. So that to me is a red flag saying, wait a second, something's going off the rails here in terms of the way in which the industry is either dispatching aircraft or having pilot competencies. So I think that, the TSB is going to be the organization that's going to flag anything that's really endemic in the industry that has to be addressed.
I- and we know that during the search for this craft, Terrace Search and Rescue was involved. David Jeffson told CBC News the Joint Rescue Coordination Center in Victoria also assisted them in that rescue and recovery. What impact does it have when there are numerous agencies involved? Does it become more complicated, or does it help to streamline things?
Well, I think that somebody has to take the lead in this one. From what I understand, the other two helicopters that were part of this excursion did in fact land in that snowfield where the crash occurred, and they moved those four injured passengers from that crash to the hospital in Terrace. So they had enough airlift capability to in fact get those seriously injured excursionists onto those aircraft and move them out. But I think the CH-146 out of Cormorant, out of Victoria, was there to provide additional support if in case the weather turned bad. So there was a lot of aircraft in the vicinity that were there on standby as needed to basically help in either search or rescue. And I think that it was very well coordinated. I don't think there was any confusion in terms of who does what.
Okay, and as you mentioned, yes, the four critically injured patients were taken to Mills Memorial Hospital in Terrace, and for people who, as you mentioned, this is becoming more common, quite expensive to participate in a heli-skiing excursion. For people who are interested, what should they be looking for, to ensure their safety?
Well, yeah, I think the first thing is really how long has this operator been in the business, and what type of track record does this operator have in the business? The new operators may be having superior equipment and superior training, but you make your reputation in heli skiing by having accident-free excursions. And I think everybody's, that goes into these excursions, that looks to shop around these excursions, and they're getting very popular, not only with BC residents, but skier enthusiasts around the world. You have them coming in from Japan, from Korea, from China, from Germany, from Switzerland. They're all, looking to get that heli-skiing experience in the Canadian Rockies. And so there's a lot of attention being paid to getting more and more aircraft lift out of the, into the back country for heli-skiing. So you have to basically make sure that you do your homework in understanding the reputation and the capability and an understanding of what the safety record is of these carriers operating into these heli-skiing locations.
And and you mentioned the international attention there, underscoring the tragedy of this: 3 people dead, 4 injured. How far does news of that travel when you have global visitors interested in these types of visits? Does that have an impact on BC's reputation?
It does. I think that I was scanning the world media to figure out how far afield the coverage has been for this incident, and it's in the UK, big time. It's on the continent in a number of locations. So the media is in fact very quick to report on these incidents, and I think there is some need for what we call damage control fairly quickly to basically reassure the traveling public, and particularly those individuals that are looking to travel to BC and Alberta for heli-skiing, that the situation, this was a rare situation. It was unique, and it's not the way we normally do business in heli-skiing. So I think that message has to be reinforced by the industry somehow, some way over the next few days, and that we basically find out what happened very quickly to this incident and see if we can learn some lessons to make sure it doesn't recur.
John Graddick, thank you so much for joining us.
My pleasure. Have a great day. Take care.
You too. Take care. John Graddick is a lecturer and the coordinator of the Aviation Management Program at McGill University. And yes, a statement from Northern Escape Heli-skiing from the company's president, John Forrest, said that it expressed its condolences to those affected by the crash and, quote, "It is impossible to put into words the profound grief that we feel and the sorrow that our guests and staff share." And this afternoon as well, Northern Escape Heli-skiing will make a brief statement at 3 p.m. this afternoon. That's in Terrace. So we will have more coverage of that coming up here on CBC. It's now 12:18, 1:18 in the Mountain Time Zone. You're with BC Today. Well, the federal government is reducing the number of student permits by 35% for 2024. Immigration Minister Mark Miller says the goal is in part to target private institutions he described as the diploma equivalent of puppy mills. And we covered this on the show yesterday, and you've been getting in touch with your own thoughts. And David emailed us, "I teach at Kwantlen Polytechnic. My largely working class students tell me the challenges they face in terms of housing, transportation, and tuition costs. If our federal government was really serious, it would transfer more funds to the provinces and provide more programs for supporting student housing, public housing, and co-op housing. We need more commitment to programs and core funding for our public post-secondary institutions so they're not so reliant on exploiting international students for tuition." And Michael writes, "For decades, legitimate private institutions have been attempting to get strong regulations directed at, quote, bad players. There have been no effective results and little response from government. If this announcement really means change, it's a good thing, but it's too little and way too late. Meanwhile, reducing the number of international students will negatively affect legitimate institutions and the employment of their teaching staff. Foreign students will go to our competitors, England, Australia, and the US. Keep those emails coming. BC Today at cbc.ca. Thanks so much for all of your thoughts. And BC's post-secondary education minister, Selena Robinson, told us yesterday the province is working on actions that will improve oversight and accountability of private education providers. Those measures to be announced next week. 12:20 now, 1:20 in the Mountain Time Zone. In Metro Vancouver, it is the second day of that 48-hour strike by public transit workers. Buses and the C-Bus remain out of service today, and that's taking a toll on commuters. Marisol Villegas takes the C-Bus into downtown Vancouver from North Van to work as a house cleaner. And she told the CBC the impact the strike is having on her.
Most of my work literally is in Vancouver, and I tried to take an Uber this morning, and was literally this guy canceled my ride because he said my little car can fit in the truck. And for me, it's very upset because it's at least $26 for go to Vancouver and then go back to North Vancouver. So it's like a $60 round. And it's for me, it's very impossible because I clean houses and I cannot afford that money. So for me, it's very important to take the ride from my C-Bus every day for 15 years right now. And now this is stopped and it's impossible. And I can't believe it, and I'm very upset because I don't know how can I go to Vancouver right now because for this strike, I don't know when it's gonna over. So I feel very bad because I don't have car, right? So I don't know. Sorry, I feel very bad. I feel very upset. So please fix it. Strike over, please, because we need the buses right now. And I feel very upset. Sorry, I feel very bad.
Now, while normal service is expected to resume tomorrow, CUPE Representative Liam O'Neill says the union is looking to escalate its job action. The SkyTrain, West Coast Express, Handy Dart, West Vancouver Blue Bus, and community shuttles in Langley and on Bowen Island are not affected by the strike. So what is behind the strike in the first place? The CBC's Justin McElroy joins me now to go through some of those details. Hi, Justin.
Hi, Michelle.
So go through some of that with us. You know, what people may think, okay, transit workers are on strike. Who actually is on strike?
Yeah, and it's important to recognize because, like you said, there are parts of the transit system that are still in operation because we're talking about one particular union here, CUPE Local 4500. They represent about 180 or so workers, and these are transit supervisors, people that are shift service supervisors, supervisors of mechanics, other trade supervisors within the overall bus and C-Bus system. So because of the action that they are taking, they had a 3-year agreement with TransLink through the Coast Mountain Bus Company. That agreement expired at the end of this year, so they do not have a contract. They voted to take strike action. They decided on 48 hours to begin with. So we're talking about just these 180 and this one particular facet of the transit system that's being negotiated through collective bargaining right now.
And in those negotiations, what is it that they're demanding?
The main issue is higher wages. You know, sometimes we hear about in different collective bargaining issues, well, it's about benefits here or it's certain clauses there, but sometimes it does just come down to the money. And based on everything that we've been hearing, that is the dominant factor here. Specifically, the argument that the union is making is that they want their supervisors to be making equivalent wages to supervisors in other parts of the hierarchy of the transit system.
And on the side of Coast Mountain Bus Company, that subsidiary there, what have they been putting on the table?
Well, and this is, you know, it's always difficult to know with 100% accuracy what's happening in the labor
we're getting
dispute
it from media releases, right?
Exactly. And both sides decide to negotiate through the media in different ways. So, for example, TransLink has, and a Coast Mountain Bus Company has said that what they have been offering is somewhere around a 13.5% increase for most of these supervisors. That would get them from around anywhere from around $95,000 up to about $110,000, $115,000. Again, there's 4 or 5 different categories within those 180 workers, so it's hard to dig into the details too much. But that's what they're saying, and they're saying that the union is demanding a 20 to 25% increase. Now, the union has said that that's not necessarily accurate, but they haven't released their numbers and what their specific offers are yet. So we're left with this not entirely 100% certainty about what is going on here and the differences between the two of them right now. But they're large enough, evidently, for this 48-hour strike to happen, and large enough that they haven't been able to settle it over that course of time.
Yes, and on the weekend there were mediated talks. What happened actually? Because this has been rumbling for a while, and then here comes the weekend. The possibility of a 48-hour strike, and come early Monday morning, here it is. What exactly happened?
Well, what happened is they couldn't come to a deal, all right?
Yeah.
I mean, Vince Reddy, who
Yes.
has been involved in labor disputes in this province and solving them since time immemorial, it would seem, was appointed to try and find a solution here, but that ended up not coming to fruition. So the union clearly said several days ago, this is what's on the table, this is what we're threatening to do. And so when they failed to come up with an agreement, pretty straightforward for them to go forward with that 48-hour notice. And since then, no negotiations have happened since that burst. And so we're waiting to hear when or if more negotiations might take place.
Yeah. When people hear this news, they may think, wasn't there something about a possible strike just a couple of years ago, maybe a few years ago, 2019?
Yeah.
It was the bus drivers.
Late 2019. And that was a different union, though. That was QP Local 7000. So again, our transit system is complex, and the different unions involved in different parts of it are too. Now, in that case, there was an overtime ban that was put in place and existed for a few weeks before, which meant that there were some cancellations here and there when management for TransLink weren't able to find the workers to fill those gaps that were needed in certain places. And there were 2 times that there was going to be full-on action for the entire system where people were anticipating a shutdown. In one case, an interim solution was figured out, and the second time they were able to come up with a full agreement or tentative agreement that staved that off. This time, no tentative agreement or second or interim solution was figured out, which is why we have this situation in place, and that overtime ban has been in place by the workers in this dispute for some time now. But when you're only dealing with 180 people versus 1,100, it's easier for TransLink to not have the stoppages, at least until Monday, that we saw with that full-blown strike for the entire system 4 years ago.
Right, and the reason that the buses themselves aren't running is because of pickets.
Yeah, and other unions abiding by it. Now, there's a question as to whether there's an application by unions to allow SkyTrain stations to be part of potential picketing actions in the future. That hasn't been resolved yet. In fact, it hasn't been heard. And as a result, that's part of the reason why SkyTrain services are still going today and yesterday as well.
Yeah. A lot of uncertainty, though, Justin.
A lot of uncertainty, and we don't know what. All we know at this point is that service will be back in action on Wednesday, but in terms of when another escalation could happen, a lot still to be figured out.
Okay. Deep breath, everybody. I'm waiting to see what happens this afternoon when it comes to the commute. Certainly very busy this morning on the roads as people look for other options to get into work or wherever they may have to go. Justin, thanks for staying on top of this for us.
Thanks, Michelle.
That is CBC's Municipal Affairs reporter, Justin McElroy. And of course, we will stay on top of this story for you, the Metro Vancouver transit strike by the union and representing some transit supervisors and communications workers. And we'll look to see what happens over the course of the next few hours. No negotiations scheduled. The 48-hour strike is set to end tomorrow. And we'll continue to follow, of course, the latest for you here throughout the day on CBC. It is just about 12:30 now, 1:30 in the Mountain Time Zone. You're with BC Today here on CBC. I'm Michelle Eliot. Very good to be with you this afternoon. Coming up in our next half hour, we're going to talk about mental health and the cost of seeking treatment. There's an SFU study that has found seeking treatment for depression can cost people out of pocket hundreds of dollars. So we're going to ask you about those costs and how much of a barrier they can be to seeking help. That's coming up after this CBC News Update with Zara Premji.
Good afternoon. Ride-hailing operations have capped surge pricing as demand in Metro Vancouver spike because of the ongoing bus strike. Both Uber and Lyft say they are placing limits to prevent riders' fares from escalating excessively as transit riders look for alternative ways to commute. Uber says the number of drivers spiked more than 70% between 7 and 8 a.m. on Monday, but it is not reasonable to expect the service to fill the gap created by the bus strike. And the RCMP and Terrace have confirmed the deaths of 3 people yesterday in a helicopter crash. 4 others were seriously injured. They were on a heli-skiing adventure in a remote area northwest of Terrace. The doomed helicopter was one of 3 transporting a large group of skiers. The cause of the crash is still under investigation. Taking a quick look at your weather now for coastal sections of the North Coast. Periods of rain, the high sitting near 6. For the Peace region, a mix of sun and clouds sitting near a balmy -13. For the central interior, flurries today, wind chill values near -5. For the Boundary and Kootenay regions, cloudy with a chance of showers and highs near 5. For the Okanagan and southern interior, slight chance of showers sitting at a steady 4 degrees. Metro Vancouver, Greater Victoria and the Fraser Valley, a mix of sun and cloud for the rest of your day and highs near 8. And that's your CBC News from Vancouver.
Thank you very much, Zara Premji. You know, yesterday we talked about bike touring, traveling through the countryside or through a city by bike. And a lot of people brought up Europe and London. And I know you have just been on a trip to Europe, haven't you?
Yes, I just went backpacking through Budapest, Prague, Vienna, a bit of England.
Oh, you know how we go, how we
and then
do.
just popped over to Morocco, just pop over.
Yes. I saw your photos. They were stunning. I was living vicariously. I have not been for a very long time.
You know what? Hop on the next backpacking or
Yes.
biking tour with me, and I promise it'll be a great experience.
I don't doubt that. We can go tandem. I'll
Yes,
I'll be right
so
behind
much
you.
easier.
Yes, you do all the work.
Okay, you carry the bags though.
That's right. I'll carry all our luggage.
Deal.
Deal. Okay, Zara, thank you very much.
Thanks, Michelle.
That is Zara Premji coming to you from the CBC Vancouver newsroom. Welcome back. This is BC Today on CBC Radio 1. Now, in our last half hour, we were talking about the Metro Vancouver transit strike, and Janet writes us from Richmond, the inconvenience caused is impacting too many people. I missed a very important doctor appointment at VG8 yesterday. Even though I left lots of time, there was no parking at any of the parkades in the vicinity of VGH. So the impacts are far beyond people not being able to get to work who don't have cars. Janet, thank you so much for that. I'm sorry that you did miss this very important doctor appointment, and certainly talking to the impact of the 48-hour transit strike throughout Metro Vancouver. This is BC Today. We are live streaming as well as being live on radio. You can watch us on our website, cbc.ca/BC. You can use the CBC News app or CBC Gem, and you can find us on YouTube as well. CBC Vancouver is the page. Now, we often talk about stigma associated with mental health issues and how that can be a barrier to seeking help. Well, what about the cost of treatment? A new study out of Simon Fraser University has found that while treating depression costs BC's health system more than $1.5 billion over 2 years, that's a fraction of the total cost of treating the illness, and that patients themselves can pay hundreds of dollars each. And British Columbians with a lower income are at risk of not getting that help. We'll be joined by the researcher in just a moment, and we'd love to hear from you as well. You can call in and share your own thoughts. What are the costs of getting treatment for depression? And are those costs a barrier to seeking help for mental health issues? You can give us a call, 1-800-825-5950, 604-669-3733, and you can also hit pound 690 on your cell phone. If you'd rather email us, our email address is bctoday@cbc.ca. Sonia Cressman is an expert in health economics and health equity. She's an adjunct professor at SFU's Faculty of Health Sciences and joins me now. Good afternoon.
Hi.
Thank you very much for joining us. I wonder if you can sit forward a little bit more so that we can hear you better through the microphone. I hope that's comfortable. I know we're sitting on these very tall chairs.
Oh, good. Is that better?
I can hear you very, very well. Thank you for that. What made you want to look into this in the first place, the cost to individuals of seeking help and getting treatment for depression?
I think people who have depression were guiding us this way with this study. It was nested in a larger study with researchers looking at better ways to effectively manage major depression early on. And they were specifically looking at a genomic test. And we wanted to get a really accurate capture of the costs, and not just from the perspective of the health system, but from other parts of society. And so we consulted with an engagement group, and that had patients on it. It had health practitioners, physicians, pharmacists, people who work closely, and policymakers as well. All of them unanimously gave us the message that we need to be considering what patients pay, because a lot is passed on and it's invisible in the analysis unless you really dig deep.
Right. I'm trying to recall any discussion around this, and it feels like there hasn't been much anyway.
Yeah. A lot of the costs you have to dig deep for. The data is just not as available as health system costs, for example, where we can catch every cost that is paid for through your pharmacare or a medical services plan.
So can you take us through some of those costs then? How much are people spending?
Yeah. The largest chunk of the costs paid outside of the healthcare system comes from how depression impacts your productivity, whether it's your paid or unpaid work. Because the illness is so closely linked to your ability to perform at work, to retain a job, and then if you do are able to work, or you may have functional depression, you also might face stigma in the workplace for time lost from work and other barriers to advancement. And so it was really a message that we received was that we had to account for it, and that it's not accounted for well.
Wow. How emphatically did people send you that message?
It was a loud, resounding, yes, you need to do this.
Wow. And, of course, that comes at a time when you're already experiencing crisis. And then it's impacting your ability to work and then to make money as well. And what about the cost of actually getting treatment, whether it's counseling or medication?
Yeah. So that's another component. So we had lost productivity. And those we consider out-of-pocket costs. So things that patients have to pay straight up. For example, co-pays on prescription drugs, or payment for counseling or psychology services. I think that's a really major concern in British Columbia in particular. And that's assuming you've got enough go to access the treatments and take action and see your doctor.
Right. By go, you mean energy.
Yeah, exactly.
And so in dollar amounts, what did you find?
Well, we found that depending on the severity of depression, that it can cost up to $700 a week for major, serious, severe depression, and that for depression that's refractory to treatment, if the treatments don't work, it can be up to over $1,000 per week that people are paying through either their lost income, their out-of-pocket expenses, or we also included informal caregiving, because people who have a relative or a friend or a family with depression know that they need love and they need time to care for them and help support them in getting treatment.
Yeah. Who does this impact the most?
So when you think about the amount of spending that you devote on your health, you think about how much you have. And we looked at the expenditure proportion after you account for the cost of living in BC, like paying rent and mortgage and transport.
I know about that, yeah.
Yeah, and we did see that low-income groups are particularly susceptible to a high expenditure proportion. We call that financial hardship, and that we are 6 areas in the province are at a particularly high risk, and urban areas as well.
Okay, and those 6 areas, these are geographic areas?
Yeah.
Okay, and where's that?
Salmonarum, a couple of regions on the island. I think Port Alberni, I think Nanaimo, Revelstoke, and Vancouver and Victoria as well fell in that area.
Okay. We're going to take some calls now. This is a discussion around the cost of seeking treatment for major depression. And an SFU study has found that while treating depression can cost the healthcare system, it actually also costs the patients themselves, and that it is lower income British Columbians who are at risk. And so we're asking you, what are the costs of getting treatment first of all, but also how much of a barrier are they to seeking help for mental health issues? You can call us if you'd like to share. Our number is 1-800-825-5950, 604-669-3733, and pound 690 on your cell phone. You can email bctoday@cbc.ca. My guest is Sonia Cressman, an expert in health economics and health equity, and an adjunct professor at SFU's Faculty of Health Sciences. Let's go to our callers now. And Jillian is on the line in Vancouver. Hi, Jillian. Welcome.
Hello. Thank you.
Yeah. What does this conversation mean to you?
Well, gosh, I mean, it's such an important study to really let people see the real costs. I myself have lived with clinical depression. I'm 63 now, but wasn't diagnosed until I was 35. But prior to that, I was very fortunate to have a family that could afford therapy. And that was obviously something that saved me. But then, as I grew up to be independent and whatnot, sometimes I was gainfully employed, other times not so much.
Sure.
And that would affect my ability to continue with my therapy. And that's critical. I mean, taking medication, also critical for me. But in the earlier days of my depression, really getting to understand what was behind it, having somebody I could rely on, somebody who knew my story, not bouncing around to different therapists, So finding somebody like that is hard to do. And then it's also expensive for someone like me who needed to go for not just a few weeks, but for years. And there were times when I couldn't afford to go, which is critical for people when they were in a state that I was in when I was a younger woman. Absolutely critical. And I find for people who are left dangling without a support system, I've always had wonderful friends and wonderful family, and I always think about the people who do not have those things to at least get them by. All the pieces are not there for so many people in this country.
Wow. Jillian, I think you've hit the nail on the head on so many things, including the importance of that support system. What was most important to you when it came to what your friends and your family offered you?
They just knew that they knew what my situation was, that I was living with depression. And some of my girlfriends, I kind of had a little code word, like, hey, can you call me? Or just something like that takes on a different meaning when you're not feeling well.
Sure.
So I let my girlfriends know that, and my sisters, and, people just to know that I could talk. That one of the things about depression for a lot of people is that they don't really want to talk. They don't really want to do anything. So knowing if you have somewhere to go to talk, if you can afford to go to therapy, sometimes because that's a neutral person, that can make all the difference in the world. Sometimes you don't want to talk to your family or your friends. But if you have somewhere to go who's neutral and who will be honest and help you and guide you, that's what changed my life for me and has enabled me to live the wonderful life that I live now. Even though I still live with clinical depression and I take medication every day, but I'm living a happy, healthy life now. And it was because I had a therapist who had the time, and I found the money when I could to continue to see her.
Oh, Jillian, as I say, you've really zeroed in on so many important things. I really appreciate your sharing. This is very personal. And is there something that you'd like to see then as a solution, coming out of your experience and perhaps others as well?
Well, I know that my friends, people who call me and say, do you know of a therapist? Well, that is probably the most difficult thing because these therapists can only take so many clients themselves. So I think we need to be training more people. I think there needs to be more supports for those people who want to go to school and learn this amazing skill that saved lives. You know, we talk about doctors saving lives and hospital technicians and, you know, everybody, ambulance drivers saving lives, but therapists also save lives. And I think we need more of them and more of the system that would allow people without money to get the help that they need.
You've said it all so powerfully, Jillian. Thank you so much. I really appreciate this conversation with you.
You're welcome. It's a key. I'm really passionate about it because I've lived it, and I understand how much of it there is. So many sad people, but there is hope if we can just find the support systems for people.
Support system. Jillian, thank you very much for the call. Take care. All the best.
You're welcome. Bye.
Bye-bye. Wow. I think I asked about how empathically people made or emphatically rather, people made that point to you, Sonia. I mean, she really made the case there, right? The need for that support system.
Yeah, an unresounding message.
Absolutely. What, she talked about when you need the ability to pay, which is not equal among people, and even throughout her life as well. There are years when you can't, and years when you can, and then the ability to get support. How can we make that more equal?
I think the financial barrier to accessing treatment is really actionable. I think if we had these systems where you have to pay ahead of time, and sometimes that can be $200 per appointment just for one appointment, and you may need 12, and then you might have to wait a couple of weeks to be reimbursed for that payment, and then find out that therapist isn't a good match for you and have to start again. So really supporting people with those financial barriers.
Yeah, she touched on that as well, didn't she? And also a shortage, a wait list for the therapists as well. I just want to put out the numbers for mental health support because this is a discussion about mental health. You can call for support 24 hours, 310-6789. And for crisis support, of course, there's that new number, 988. Just the three numbers, 3 digits. 988 is the number you can call for crisis support. And we are discussing those barriers to getting treatment for, in this case, depression, major depressive disorder, as a study out of SFU has found that people are paying out of pocket, whether it's through lost work, lost opportunities, and out-of-pocket costs as well when it comes to finding therapies and treatment. And we're asking you, how much of a barrier is that cost to getting treatment for mental illness? Our numbers again are 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. And we have some emails now to bctoday@cbc.ca. And Grace writes, mental health is concerning the brain, just like dental coverage is about the mouth and the teeth. All should be covered by medical insurance, and treatment should be available. Lisa writes, I've never been depressed, but if I hadn't been able to pay for counseling, for grief counseling and sexual harassment counseling, I might have been. I think a lot of people are very depressed because it is too costly to deal with it. Thank you so much for sharing. bctoday@cbc.ca is our email address. And so, Sonia, you mentioned the cost to the health system, which is what gets a lot of discussion, a lot of coverage. 1.5 billion over 2 years is what you found. Given that amount of spending already, can the system afford to expand to include, some of those more immediate costs that aren't covered right now?
So I just need to clarify that that $1.5 billion, that is for all healthcare costs. And it's not necessarily caused by the depression, like it could be visits to the hospital. But we do see that people who do fit the criteria of having a depression diagnosis have higher healthcare costs for everything.
Okay. So clarifying that. Okay, that's all healthcare.
Yeah, and to think about this in terms of where the costs are being distributed within the system, whether it's a visit with a family physician or preventing an emergency room admission or admission to hospital by treating it early. These are things that we need to consider in the economic evaluation. We have to look at the full scope of the problem and who's paying what and the cost sharing distribution.
Yeah. Well, how would you justify that increasing the cost then for the system?
You have to look at the whole system and see where the distribution changes as a result of that cost. So if we increase prevention, for example, does that increase downstream costs?
Yeah, and in terms of, I'm sure you would say that is important because that would you say that increases costs down the road if a case becomes even more severe from not having been able to access that treatment?
Absolutely, from a cost perspective and 100% from an outcomes perspective. When you think about people's health, you don't want to be in the hospital and you don't want to risk.
Sure, and we here in BC are dealing still with this with rising deaths from the overdose crisis. Do you see a connection between these barriers to getting access to treatment and is there still this intractable crisis?
Yeah, I think that's another one of those invisible costs is what is the relationship? And we don't have data on it. We don't speak to it. It's been illegal for a long time, so we haven't been able to collect data on it.
What's been illegal?
Drug use. And,
right. Yeah. Okay. So in terms of barring the decriminalization of personal possession, but that might be. Yeah, I was wondering about what you thought of that when it comes to the consequences of not getting access to that care.
Yeah, I do think there is a pretty solid evidence base that they're associated, and that if you reduce depression, we should be looking at the impact downstream on the overdose crisis and toxic supply and deaths that way.
Yeah. Let's take another call here. Kirsty is on the line Kirsty from Port Alberni. And this was one of the communities that you touched on, I think, Sonia. So, Hi, Kirsty. Thanks so much for calling in.
Hi, can you guys hear me okay?
We sure can. Yeah, go ahead.
Oh, good. Yeah, so I was just listening to the show and just feeling, like so many of the points being raised are really important. And one thing that I haven't really heard talked about, but I really would like someone to look into is in terms of extended health benefit plans. So for employees who have employers that do offer those extended health benefits, it's a great idea and it can help people a lot. But living in a community like Port Alberni, we do not have a single psychologist that I'm aware of in this community. And my personal extended health benefit plan will only cover me to see a psychologist. So I could potentially find somebody virtually if I felt comfortable with that and navigate that. But again, my extended health plan will only cover up to $700 annually. And I believe one visit per psychologist is $225. So that is less than 4 visits in total per year that I could access through my extended plan. And so I would really like to see employers consider expanding who their employees can see under their extended health benefits to include registered clinical counselors and, even social workers if the community doesn't have the registered clinical counselors as an option. I know that for myself, I found out about an online service that's super affordable. So I've been accessing online counseling through an Ally program and seeing a master's student. And it's a sliding scale, so I pay $35 per session. It's fantastic for me, but it's not a tax redeemable cost because it's a Ontario-based registered psychotherapist, which isn't a tax deduction in BC. So I'm rambling, but my point is it's hard to access services in my own community. It's hard to access services I can afford, and it's hard to, add that additional cost personally, where I'd like to see there be more benefits for people that actually work for them. So,
Yeah.
thanks for listening.
Thank you so much, and you've explained yourself well there. You have been able to work around the system, right? The lack of a provider in your community of Port Alberni, the limit to what you are covered for, and so you've been able to find a way around. But yes, that discussion of extending the definition, perhaps when it comes to coverage. Can I ask you, Sonia? There's talk about the pharmacare program, for example, the federal pharmacare. What could coverage look like ideally, in your view?
I think there's people that come close to the threshold for financial hardship, and this is something defined by the World Health Organization when you think about how much you have to pay versus how much you've got left over. And there are some priority groups there that decision makers could focus on and, sort of build in a safety net.
Right. Could this become part of that conversation around, we are talking about pharmacare coverage, for example?
Mm-hmm. Yeah, absolutely. The pharmacare does have a threshold for financial hardship, and they do have a stated value that they will not let patients go through. And the same could be done for mental health treatments for depression.
I just have about a minute left, but Joan in Victoria, you wanted to mention that you have a friend who's a therapist?
Yes. I wanted to make the point that she has explained to me. She has a master's in counseling and has been a therapist for a number of years and is excellent. And she cannot, people who have masters in counseling, which are many of the counselors out there, are not permitted to be a member of the College of Psychologists or whatever the governing authority is called. And so they are not available for people who have extended benefits.
And is she a trained psychologist, though?
Yeah, she has her master's in counseling. And a lot of the people that you call psychologists, I think maybe the College of Psychologists might say, oh, no, they're just therapists. But she also has trauma counseling and training, and she's excellent, but she cannot get covered. And so it's the college that's preventing it.
Okay, again, about the access, and there might be a conversation there around credentials, but we obviously don't have the college here with us today. But Joan, you get to that point that we heard earlier from our guest as well, that from our caller, that if only there were more therapists who were available. Sonia Cressman, you've started a conversation here, I think, that has really resonated with people. Thank you so much.
Thank you for having me.
Great to have you. Sonia Cressman, an expert in health economics and health equity, an adjunct professor at SFU's Faculty of Health Sciences. And that's it for our show. Thanks for all of your calls, joining the discussion. You can always email us, bctoday@cbc.ca. Join us tomorrow on the show. We'll talk about working multiple jobs. Our colleagues in Newfoundland have been working on a series called The Grind and the challenges of working multiple jobs because you have to keep up with inflation. We'll take your calls tomorrow. I'm Michelle Eliot. Thanks so much for joining us on BC Today. Have a great afternoon.